Hi, can you hear me? And can you see me? Cam, can you hear me? Hello, Kim, can you hear me?
Hello, can you hear me?
Yes, I can hear you loud and clear.
Wonderful. I can see you as well.
Okay, good. Thank you.
Hi, Tim. Can you hear me? Can you hear me and see me? Jose?
Can you hear me and see me?
No, I can hear you.
Oh, well, of course. I can hear you great. Thanks.
All right, thank you, Kim.
Good afternoon, Dr. Freer.
Hey, good afternoon. I'm ready to go.
Okay,
It's
great.
2 o'clock.
Give
Thanks,
me
Kim.
one moment.
Okay.
Good afternoon, and thank you for joining the Los Angeles County Department of Public Health today, October 14th, for a media briefing. Today we have Director of Public Health, Dr. Barbara Freer, presenting. Dr. Freer will then take your questions. To ask a question, please use the hand icon, or you may chat me, the host. Dr. Freer, when you are ready.
Thanks so much, Kim, and thank you everyone for joining me for today's briefing. This afternoon, I'll be presenting our metrics on vaccination status and age group, and we'll be discussing what information we get from the numbers and what we understand when we look at the rates. I'll also provide updates on variants, school and youth sport cases and outbreaks, and our vaccination progress. And I'll close by sharing information about implementing the new vaccination requirements in our health officer order. We can take the first slide. We're sad to report 19 additional deaths today. At least 14 of the people who died had underlying health conditions, and it does bring the total number of deaths to 26,372 in LA County. To everyone who's lost friends and families during this difficult time, we're wishing you peace and comfort, and our prayers remain with you. We're also reporting 1,142 new cases today, bringing the total number of cases in LA County to 1,474,518. To date, more than 8.8 million people have been tested and had test results reported in LA County. And our daily test positivity rate is just about 1%, a very small decrease from last week's rate of 1.1%. Our average daily case rate with the 3-day lag is now 8.1 cases per 100,000 people. This is a slightly more than 1 point decrease from last week's case rate of 9.4 cases per 100,000 people. CDC reports that our weekly case rate is now 76 new cases per 100,000 residents, reflecting continued substantial transmission across the county. There are 698 people currently hospitalized with COVID-19, and this is a decrease of 52 people over the past week. Currently, we have 187 open outbreak investigations at residential congregate settings and non-residential settings. We can see the next slide. This graph shows the trends in cases, hospitalizations, and deaths in our county from the beginning of the pandemic through October 6th of this year. The slight downward trend across all these metrics has continued, with our daily average case numbers now below 1,000 as of October 5th. Our daily average number of cases is about 925. This is down 18% from the prior week. Meanwhile, daily average hospitalizations are down below 750. This is a 14% reduction from the prior week, and deaths decreased 25%. For an average of 12 people passing away every day. Although we're thankful to see the numbers declining, we still have substantial transmission, and we're going to need to be vigilant if we want to reduce the spread of the virus. Next slide. We do track data using counts so that we can capture the burden of the virus on residents and communities. This slide shows our case and hospitalization counts since March of 2020, sorted by vaccination status. Here, the dotted lines represent outcomes in unvaccinated people, while the solid lines represent outcomes among those who have been vaccinated. Since July of 2021, unvaccinated people have accounted for most of the cases and hospitalizations, as you can see when you look at those dotted green and orange lines. When the lines are closer together, while the lines are closer together now that we're not in the middle of the surge, there were still twice as many infected people who were unvaccinated than there were who were vaccinated. Next slide. Here you see deaths by vaccination status with the dotted lines, again representing outcomes in unvaccinated people, and the solid lines representing outcomes in vaccinated people. The number of deaths among vaccinated people has been nearly flat during the entire recent surge. And you can see that when you look at the solid line, that's almost indistinguishable from the chart axis at the near bottom of the page. Although deaths are now declining for everyone, we're still seeing, as I noted, about 12 deaths a day. And the vast majority, unfortunately, are among unvaccinated people. Next slide. We've received several requests for data based on our raw numbers of cases, hospitalizations, and deaths by vaccination status. In order to be transparent, we're sharing the numbers with you today over the next few slides. But one reason why we don't routinely share these raw numbers is because they only tell a part of the story. And here we're looking for about a month's worth of data. We can start by looking at the case numbers by age group that you see on this slide. You see the numbers of cases that were among unvaccinated or fully vaccinated 12 to 17-year-olds, 18 to 49-year-olds, and adults over 50. And as I said, this is between August 29th and October 1st of this year. You'll note that among teens and younger adults, the number of cases among unvaccinated people is much higher than the number among vaccinated people. Meanwhile, among adults 50 and over, more vaccinated people became infected than those who were unvaccinated. Some may look at this last set of numbers and you're wondering if the vaccine is dramatically less effective in older people than in younger people. That's because these numbers are lacking a key piece of information, namely the number of unvaccinated and vaccinated people who could have gotten infected over the same 1 month period. Among the 2.9 million adults 50 and over in LA County, those groups of unvaccinated and vaccinated individuals are very different sizes because 78% of adults in this age group are fully vaccinated. 5,000 infections out of 2.3 million fully vaccinated people is a very different, much smaller, and in this context, less concerning number than the 5,000 infections that we had out of 425,000 unvaccinated people. You can go on to the next slide. This slide, tries to do something like that and shows our case rates per 100,000 people over the same time interval, also divided by vaccination status and age. And it provides us with a much more complete picture of what's really happening. Many times more unvaccinated people in each age group are becoming infected than are vaccinated people. While the previous slide might lead you to believe that unvaccinated and vaccinated adults over 50 have about the same risk of infection, this slide shows that the risk to unvaccinated adults over 50 is actually 5 times greater than the risk to their vaccinated counterparts. 1,124 cases per 100,000 unvaccinated people compared to 222 cases per 100,000 vaccinated people. Next slide. We can also look at recent hospitalizations first by the raw numbers. As you can see, hospitalizations are very rare among teens, and they're most common in older adults. In all age groups, the numbers of hospitalizations are substantially higher among unvaccinated people than those who have been vaccinated. We can go to the next slide. But again, as the rates show, the raw numbers aren't telling the whole story. While the previous slide indicated that hospitalized people in these 3 age groups were 2 to 9 times more likely to be unvaccinated than vaccinated, the rates on this slide show that the risk to unvaccinated people of becoming hospitalized is actually 12 to 22 times higher than it is for vaccinated people. Next slide. The degree of protection afforded to people by vaccines, especially among older adults, is again not well explained by this visualization of the number of deaths by age group and vaccination status. You can note that the deaths counted over this period, that of the deaths that are counted over this period, 21 times as many were among unvaccinated 18 to 49-year-olds, and 3 times as many were on unvaccinated adults 50 and over than were among vaccinated people in these age groups. But however, and you can go to the next slide, when we look at these death numbers, considering the total group population numbers, we see that the death rates are in fact 32 times higher among unvaccinated 18 to 49-year-olds and 20 times higher among unvaccinated adults over 50. Although we're regularly going to be sharing both the raw numbers and the rates going forward, the actual impact of the pandemic and the true magnitude of vaccine protections are probably much better understood when we look at the rates. Next slide. To help quantify the level of protection vaccines afford us, we're going to continue to share the outcomes among fully vaccinated people. The graphic on this slide shows the number of cases, hospitalizations, and deaths among fully vaccinated people to scale. The large green box represents the more than 5.7 million residents that are now fully vaccinated. The tiny purple box in the left lower corner of the green box represents to scale the nearly 61,000 fully vaccinated people who tested positive for COVID as of October 9th. In all, a little over 1% of fully vaccinated people in LA County have now tested positive. Of those who tested positive, a little over 2,000 people were hospitalized. That's up from about 1,963 the prior week. This does translate to 0.04% of all fully vaccinated people ending up hospitalized. Deaths in this group over this interval also increased slightly from 281 to 311, translating to 0.005% of fully vaccinated people passing away. The slow increase in these numbers is not a surprise because the greater the proportion of vaccinated people in the county, the more likely that people who get infected with COVID are going to include vaccinated people. What's reassuring to us about this increase is that it's so very slow, demonstrating how powerfully protective these vaccines are from the most severe outcomes of infection with this virus. And this is what gives us confidence that measures to increase vaccination represent our best hope for ending the pandemic. Next slide. And as part of our regular monitoring to understand potential future risks, we track specimen sequencing results for LA County residents. We continue to find that the Delta variant accounts for 100% of all the variants that are reported to us. The CDC does not consider the Mu or the Lambda variants to be variants of concern, but it does now consider the Mu as a variant being monitored, indicating it has properties that warrant tracking. Because the WHO identifies both Mu and Lambda to be variants of interest, since they've been associated with significant community transmission or COVID clusters in multiple counties and multiple countries, we're going to continue to monitor this distribution of both of these variants among both new and historic samples. This week, we're reporting no newly identified Lambda or Mu variants and no other variants of concern, leaving the total number of cases linked to the Mu variants at 270 and cases linked to Lambda at 28. We're going to continue to provide regular updates on variant trends among LA County residents each week. Next slide. Given that we still have substantial transmission in LA County, K-12 schools remain focused on providing as much safety as possible for in-person learning. While we have a lot of evidence showing the protection vaccines offer, our data on school cases and close contacts demonstrates the protective impact of other preventive measures, especially masking. These trend lines show staff and student cases and close contacts. Most of the cases represented here were diagnosed through routine screening of asymptomatic people, which identifies many infected people who would not ordinarily be detected. On this chart, the lines and shades of pink represent cases, while the lines and shades of green represent the close contacts. Darker shades represent student data, while lighter shades represent staff data. And as a reminder, because the numbers of student close contacts are so much higher than all the other measures on this slide, they're plotted on a different axis that you see on the right of the slide. Last week, we saw 591 student cases and nearly 2,400 student close contacts were identified. This is a decrease of about 45% in both groups from the previous week. Among staff, we saw 88 cases and 171 close contacts. Given that we have more than 1.7 million children and staff attending or working at over 3,000 schools countywide, these are strikingly low numbers. This amounts to 0.04% of students and staff testing positive and 0.2% identified as close contacts. The very low numbers represent a lot of hard work by superintendents, staff, parents, and students to consistently implement the mitigation strategies. And these efforts make it possible to keep our school community safe. Next slide. Although most TK through grade 12 cases are not associated with outbreaks, 3 or more cases linked to transmission at schools or school programs meets the definition of an outbreak. In these cases, we devote additional resources to investigating the source and preventing transmission among students, staff, and communities. The number of outbreaks increased over the last couple of weeks, from 5 outbreaks the week ending October 2nd to 14 outbreaks for the week ending October 9th. 5 outbreaks. 9 of the outbreaks last week were in elementary schools, 3 were in youth sports, and 1 each were in elementary and middle schools. Given how many schools are open and the breadth of activities where students and staff mingle, it is not unexpected for us to see fluctuating numbers of outbreaks. Most of the outbreaks, particularly in the elementary schools, are within groups that are largely unvaccinated, where we know that transmission can be higher. Next slide. This slide shows the number of cases and close contacts linked with the outbreaks on the previous slide. What's striking is that while the number of outbreaks nearly tripled this past week, the number of cases and close contacts associated with them increased far less. Last week, student cases represented in the dark pink increased 19% from 95 to 113, while student close contacts represented in the dark green increased by 37%. Meanwhile, staff cases went from 11 to 18, and staff close contacts decreased from 11 to 1. Although the numbers of students and staff affected in the more recent outbreaks may still increase, these numbers are rising very, very slowly. Next slide. Since August 16th, we've seen a total of 21 outbreaks in youth sports programs, which is why I wanted to just talk about this for a second. 16 of these outbreaks have been associated with football, 4 were associated with cheerleading and dance teams, and 1 was associated with a baseball team. Overall, these outbreaks involved 394 cases and 1,527 contacts. Most of the infected individuals are unvaccinated. We continue to find that factors associated with the spread also include inconsistent masking, socialization on and off campus, inconsistent distancing in locker rooms and weight rooms, and shared transportation to and from events. Some of the lessons we learned on how we could avoid this spread are on this slide. Participants in school sports should try to minimize the time they spend in weight and locker rooms that are indoors. And if possible, they should be showering and changing at home, both before and after practices or games. Keeping a distance in these spaces, always wearing face masks, and avoiding mixing teams in locker rooms and weight rooms is really helpful. In weight rooms in particular, spacing equipment as much as possible to allow safe distancing of people who are using it also helps, as well as ventilating as much as possible by opening doors and windows and using fans. At practices and games and on the sidelines, keeping a distance from others and minimizing unnecessary physical contact while wearing our masks as much as possible is really helpful. Practice or play that can happen outdoors ought to always happen outdoors. And in general, vaccinating all eligible students and coaches, conducting regular screening testing, and cleaning hands frequently is known to help reduce the risk of transmission among youth sports participants. Next slide. We're fortunate that we have an ample supply of vaccines. We now have administered more than 12.7 million vaccine doses in communities across the county. As of October 10th, 93% of LA County residents 65 and over received at least 1 dose of the vaccine, as have 79% of residents 12 and over. 70% of residents 12 and over are now fully vaccinated. And 70% of LA County teens between the ages of 12 and 17 have received at least 1 dose, and 61% are fully vaccinated. Out of all of our nearly 10.3 million LA County residents, including those not yet eligible for the vaccine, 68% received at least 1 dose, and 60% are fully vaccinated. So far, nearly 270,000 additional or booster doses have been administered in LA County. As a reminder, booster doses are available right now only to those who received their second dose of Pfizer at least 6 months ago. We estimate that about 1 million LA County residents are currently eligible for the booster. And we urge that those of you who are 65 and older and 18 and older with underlying health conditions that are eligible for the Pfizer booster, be sure to get your dose before the colder weather and the holiday season. Today and tomorrow, as you all know, the FDA's Vaccines and Related Biological Products Advisory Committee is meeting to discuss the need for boosters for those vaccinated with J&J or Moderna. And we've already heard the committee today recommended approval of the Moderna booster vaccine. The committee will also review data on the safety and the efficacy of what we call mix and match with a booster dose. And that would involve receiving a different brand vaccine for the booster than what you received in the original series. Once the CDC finalizes approval for boosters, and that includes the J&J vaccine as well, and what they're going to tell us about that, our vast countywide network is prepared to begin administering these additional boosters to all eligible as determined by the CDC rules. Next slide. Although we'd love to see this chart show a large increase in the number of first doses administered across the county network, we do remain at relatively low levels. This is the chart that shows us how many first doses we're administering. As you can see, between October 4th and October 10th, we administered a little over 41,000 doses across the entire county network. And this is actually a small decrease from last week. While last week's numbers, while these numbers might rise by a few thousand once all the reporting is complete, this does indicate that our vaccination progress is still going much more slowly than we need it to go, despite all of our best efforts. The single thing that we need to do as a community to reduce our risk of another surge is we need to decrease the numbers of unvaccinated people. This is why we're going to remain committed to prioritizing helping unvaccinated people get their first doses of vaccine throughout the county. With the FDA scheduled later this month to review data on the safety and effectiveness of administering the Pfizer vaccine to children 5 to 11, our county vaccination network is preparing to meet the additional demands of administering doses to almost 900,000 children. We'll be working with schools, pediatric and family care providers, and our community partners to again ensure easy access, especially in those communities that have been hardest hit. Next slide. With the urgent need to avoid another devastating winter surge, and as you can see, a slowing down in who's getting vaccinated, new health officer orders went into effect last week to create additional protections at high-risk settings across the county. Bars, breweries, wineries, distilleries, nightclubs, and lounges, along with outdoor mega events with more than 10,000 people, are all implementing vaccine verification requirements. As of October 7th, our health officer order applying to bars, breweries, wineries, distilleries, nightclubs, and lounges required proof of at least one dose of the vaccine, cross-checked with a photo ID, for entering into the indoor portions of these establishments, and that's for all patrons and employees, except for those under 12 years old. On November 4th, this will be tightened to require proof of full vaccination. As a reminder, masks are still required indoors for everyone, and there's no negative test alternative for these establishments. A patron or an employee without proof of vaccination can only enter the indoor portions of the establishments if they're masked, and for accessing outdoor areas or restrooms, ordering or paying at the register, or picking up an order. They're not really able to stay inside. As of October 7th, our health officer order applying to outdoor mega events with more than 10,000 attendees requires proof of full vaccination or a recent negative test for all patrons 12 and over. On November 1st, there is also a requirement that this proof be cross-checked with a photo ID for patrons that are 18 and over. This is the same requirement for indoor events with over 1,000 attendees, and masks in LA County are required at all indoor and outdoor mega events. We've seen excellent compliance with the new health officer order to date, and I want to thank both the establishments and the patrons for taking this extra step to help us try to avoid a disastrous winter. I want to also acknowledge that the operational challenges at the large event venues are significant, and we're grateful for their continued partnership. Next slide. As the fall season gets into full swing, I know many of you will be headed to sports bars and our amazing local arenas to watch the big games. The best way to enjoy yourself safely is to be prepared and ready to comply with the public health directives. Before going to your favorite sports bar, ensure you and any teens coming with you have had at least one dose of the vaccine if before November 4th, or that you're fully vaccinated if on or after November 4th is when you go. Bring proof of vaccination and a photo ID for everyone in your party, and plan to wear your masks indoors except when you're actively eating or drinking. You also should consider using the outdoor areas of the establishment if you want to be extra safe. If you're headed to a local venue to see a live game, make sure you and any accompanying teens are fully vaccinated or you've had a recent negative COVID test. Plan to bring proof of vaccination or negative testing results for everyone in your party and a photo identification for people 18 and over. And once you're at the game, we ask that you wear your mask except when you're actively eating or drinking. Please note that these rules are set by the Department of Public Health, and establishments are legally required to comply. It therefore makes little sense to direct unhappiness to the staff at any of these venues. The hope is that by adding in extra protections, we avoid a winter surge that forces us to take steps backwards on our recovery journey. So please plan ahead to add these extra precautions as we experience the thrill of victory, regardless of where we're going to be watching the game. Thank you, and I'll now take your questions.
Thank you, Dr. Ferrer. Just a reminder to everyone, if you'd like to ask a question, please use the hand icon or you can chat me, the host. Our first question will be coming from Ron Lynn. Ron, you're unmuted. Go ahead.
Hi, Dr. Ferrer. Thanks so much for taking our questions. Really appreciate it. Our questions today are about enforcement at Dodger Stadium, at bars, and whether rapid tests should be used for Thanksgiving. First, one of my coworkers' friends went to both Dodgers playoff games recently in LA, and he said he was checked for his vaccination status for the first game, but not the second. And he heard that other people hadn't been screened at the second game either. Are you concerned that some people are being let into the game without that screening? Second, what's your sense in how effective bars, nightclubs, lounges, and wineries are enforcing vaccination requirements? And then finally, as we look toward Thanksgiving, there may be situations where many children under the age of 12 won't be fully vaccinated. Do you think it's helpful for vaccinated people to get rapid tests just before they enter for Thanksgiving dinner if there are children too young to be vaccinated, or there are elderly people there who have a higher risk, or is it unnecessary to do rapid tests before Thanksgiving meals? Thanks.
Yeah, thanks so much. Both great questions, Ron, and appreciate the questions on enforcement around the new health officer order. We've been working really closely with the large venues and obviously also with the bars, lounges, nightclubs, et cetera, to help them, put their systems in place so that they can, in fact, be in full compliance. And it's going to take a little bit of time, and we're aware of that. Some places have, as you know, they've already been doing this. Indoor events is a good example, indoor mega events. And we had bars and even some restaurants that have gotten their systems down and they're fully operational. And we're grateful for that. And we're also grateful for all the people who are trying to get this rolled out effectively. I had not heard about any issues really at Dodger Stadium. We did have inspectors there, and our inspectors noted at the gates they were at that people were checking. They also were offering, as many of these venues are, opportunities for people to get a rapid antigen test if they hadn't shown up with their proper identification of vaccination verification or a negative test result. But I think it will take another few days, particularly at these large venues, because they, as you know, Dodger Stadium is, 53,000 plus at these games, and they're full, and there are a lot of fans, and they have a lot of gates that are open. So we're working closely with them. And again, I want to give them all a lot of credit. I think they're doing their very best to be in full compliance. And this, gets easier as they're able to work out any of the challenges that are happening at the gates. I also want to acknowledge that the report back that we got from just about all the large venues, including our 2 theme parks, was that the vast majority of people actually showed up with the appropriate verification documents. So huge thanks to the fans and the patrons of our theme parks for actually, and patrons of our music events and our larger theater events, for actually showing up well prepared. And I'll give a shout out as well to the media for this, because you've all done a really great job of explaining what the rules are, reminding people when you're talking about the events that they need to be prepared in a different way to protect each other. And I think that's all helping. So we're pleased with where we are, and we're grateful for all the support that we're getting from all of the event venues. And if we flip that over to bars, our inspectors were out over the weekend and continue to be out, all week, and have noted, again, fairly high compliance. There are some places where there wasn't good compliance and a good understanding of exactly how the compliance needed to work and what the systems might be that could be put in place. But I do want to note that even in the sites where we noted that they weren't in full compliance, we had no issues with the management. Nobody was saying they weren't going to be in compliance on the checks we've done. I'm sure there might be some of those places, and we would anticipate that. But all of the sites that got visited over the weekend, folks were eager to figure out how they could, in fact, go ahead and make sure that they were creating this extra layer of protection for folks. So granted, we have thousands and thousands of bars and nightclubs, lounges to visit. So this was just a small sample over the first weekend. But again, I want to give a lot of credit, as we always have, for having a lot of cooperation amongst our businesses here in LA County. And I think everybody is just as concerned as we are about keeping our numbers low as we head into the colder weather and avoiding what happened last year here. So thanks for those questions. We can go on to the next question.
Our next question comes
Wait,
from.
there was one question there, so I forgot. Let me just get to, sort of the opportunity on rapid testing. Obviously, fully vaccinated people, when transmission rates are high, and as you can see, we have some transmission even among people who are fully vaccinated, and they can transmit to each other, as well as you noted, Ron, they can transmit to people who are unvaccinated. It makes sense if you're going to be, particularly with a larger group of folks, and particularly with, as you noted, people unvaccinated in that group, or people at high risk for serious consequence if they get infected. A rapid test, antigen test, is a good idea. It's not recommended when you've got lower transmission rates, because there's the issue with the false positives, but we don't have lower transmission rates here in LA County yet. And again, it's an added layer of protection, and we're using it. We have routine screening at all of our schools, and it's certainly been helpful on quickly identifying people who are positive and making sure that they're not exposing others. I think it's a personal choice, but rapid tests, antigen tests, do make sure you're using one that's approved by the FDA, I think do have an important role to play as we're going to be doing a lot more gathering, and we still will have a large number of children that will be unvaccinated. So yes, I think adding layers, I'm a big believer in adding in those layers that are appropriate to create as much safety as possible. Again, we've issued guidance around the Halloween holidays, taking everything outside. It is a holiday that's easy to celebrate outside, but I know as we get to the Thanksgiving and the winter holidays, many more things will move indoors, and appreciate the questions on rapid tests. We can go on to the next question. Sorry about that, Ron.
Our next question comes from Claudia Pashuta. Claudia, you are unmuted.
Hi, I would like to follow up on the rapid test thing, and exactly like how you recommend that people use it. Like, If you're going to a family gathering, do you test yourself in the car right before you get in? And then if you're negative, like how long can you feel safe about being around other family members? So if you could spell that out a little bit more. And then in terms of the new vaccination proof requirements, have any citations been issued at this point, or are inspectors just educating people right now? And then if you could talk a little bit more about the Moderna boosters, and you had mentioned before, I think that more than 90% of nursing home residents in the county had received Moderna. I don't know if you have like an exact percentage on that, and how significant that might be to be able to start getting the boosters out to those people. Thank you.
Yeah, great questions. Let me start with Moderna. So there were 781,000 residents in LA County who received their second dose of Moderna by April 1st. In that group are 427,000 residents 65 and older. So it's a large number, not as large. Pfizer was slightly larger. And as I noted before, at our skilled nursing facilities in LA County, the vast majority of the residents, and it is over 90%, received the Moderna vaccine. So yes, our plans are in place. As soon as there's authorization and direction from the CDC, we will begin rolling out the plan at the nursing facilities. We were already there with teams vaccinating residents. There's about 3,000 residents who've been identified as being eligible for the Pfizer booster. And again, this is a voluntary program. Those who have indicated that they want to get the booster, we're set up to be vaccinating. This is a partnership with the nursing homes, the long-term care pharmacies, and what we call our strike teams that have a lot of flexibility and can go out pretty easily to multiple sites during the day to do a specific targeted population. So we're using that same system. We anticipate it might take us between 3 and 4 weeks to get everybody who wants to get a booster fully vaccinated at all of the 350 nursing homes. But the plans are in place as soon as we get approval to start rolling that out. In terms of citations, no, we haven't issued any citations. I mean, obviously, if there were flagrant violations of other things, we'd be issuing citations when we do visits, people out of compliance with permitting requirements, et cetera. But no citations have been issued for violations of vaccination verification, health officer orders yet. And as you noted, we're very interested in just educating and providing technical assistance. So everyone will do their very best to add in these layers of protection. There's a short window of time where we're available to do all of this technical assistance and adding extra folks to help with that. But no need for citations at the very beginning. It really is about making sure everyone has good information and is coming into compliance. As always, we have found that a very small number of establishments will refuse to come into compliance, and in those situations there will be citations, and potentially you could lose your permit to operate. So I suggest folks talk to us if you've got concerns. Let our teams help you, because in many ways, particularly for the bars and the lounges and the nightclubs, these are very high risk settings where people are often unmasked, and if it's indoors, it can create a lot of risk, and that would be unfortunate for everyone: employees, employers, and customers. In terms of rapid testing, yeah, I mean, we have testing guidance on our website, so I'm going to urge people to go take a look at the antigen testing guidance for rapid tests. But everyone knows, you're negative at the point you tested. The closer you are to the point you tested, the better off you are at, knowing that as you're walking in the door, you're negative. I mean, many of us who have gone to events where even if you're vaccinated, it's required that you have a negative test prior to going into an indoor setting, have actually done the testing right before we entered, because obviously that's the closest interval that you're going to get to entering in to a specific event. So yes, there's nothing wrong with testing right before you go in. I just want to caution people, it does take a few minutes to get the test results. We have had situations where people have tested themselves and then gone in and then waited indoors, at their party or at event for their test results. And that's actually not a good strategy at all. So if you're testing right before you go, please wait until you get your test results. Make sure you're negative before you enter into the event. And with that, we can go on to the next question.
Thank you. Our next question comes from Peter Nichols. Peter, you are unmuted.
Hey, Dr. Ferrer, thank you for taking our calls. Hope you're doing well. I have a question about, I want to go way back when you and the State Department of Public Health were kind of giving us all an average based on the number of cases per day on how many of those cases might end up hospitalized. I know it's been a while. You guys used to say, hey, it's anywhere between 8 to 10 to 12%. Do we know where that case number is now? What is the average you think you're seeing? Do you have any indication of that?
Thanks. I don't have that calculation sort of in my head at the moment, but we can obviously give that to you. It's one reason why we stepped away from that is the average rates are different if you're vaccinated and if you're unvaccinated, but that's how we'll calculate it. I pretty much give you a decent sense, but I'll go back and we'll do a calculation on for everybody who gets infected. If you're unvaccinated, what's your likelihood of ending up hospitalized if you're vaccinated? What that number is as well. So thanks, Peter, and we'll get that back to you. I'll make sure somebody on our team sends you that information. So thanks. We can go on to the next question.
All right. Does anyone else have a question for Dr. Ferrer? You may chat me or use the hand icon. Okay, if there are no other questions, thank you so much, Dr. Ferrer, and thank you to everyone for joining us today. You may send any additional questions you come up with to our media inbox at media@ph.lacounty.gov. Our Spanish remarks will begin at 3 p.m. Hi, Monica.
Hi.
Hello. Would you like to go ahead and get started a couple of minutes early?
Sure, I'm ready.
Okay.
We are
Wonderful.
ready.
Okay. Can you see the screen okay?
Yes, I see the screen. Yeah, very well.
Wonderful.
Can you see me well too?
Yes.
Okay, good.
All right. Thank you, everyone, for joining us today for the Spanish portion of today's briefing. Today is October 14th. Monica is joining us today. Monica, when you're ready.
Okay, thank you so much, Kim. Y gracias por acompañarnos en la sesión informativa de hoy. Esta tarde presentaremos nuestras métricas por estado de vacunación y grupo de edad y discutiremos qué información obtenemos de los números y qué entendemos cuando miramos las tasas. También proporcionaremos actualizaciones sobre variantes, casos y brotes de deportes escolares y juveniles y nuestro progreso de vacunación y compartiremos información sobre la implementación de los nuevos requisitos de vacunación incluidos en nuestra orden del oficial de salud. En esta primera diapositiva nos entristece informar de 19 muertes adicionales hoy. Al menos 14 de las personas que murieron tenían problemas de salud subyacentes. Esto eleva el número total de muertes a 26.372 en el condado de Los Ángeles. A todos los que han perdido amigos y familiares durante este momento tan difícil, les deseamos paz y consuelo y nuestras oraciones permanecen con ustedes. Hoy estamos reportando 1.142 casos nuevos, lo que eleva el número total de casos en el condado de Los Ángeles a 1.474.518. A la fecha, más de 8,8 millones de personas se han hecho la prueba y sus resultados se han informado al condado de Los Ángeles. La tasa de casos positivos de nuestra prueba diaria es de 0,99%, una pequeña disminución con respecto a la tasa del mismo día de la semana anterior, la cual fue de 1,13%. Nuestra tasa de casos promedio diaria con un retraso de 3 días es ahora de 8,1 casos por cada 100,000 personas, una disminución de 1,3 puntos con respecto a la tasa de casos con un retraso de 3 días de la semana pasada de 9,4 casos por cada 100,000. La estimación de los CDC de nuestra tasa de casos semanales es de 76 casos nuevos por cada 100,000 residentes, lo que significa que continúa el contagio sustancial en todo el condado. Hay 698 personas actualmente hospitalizadas con COVID, una disminución de 52 personas durante la semana pasada. Actualmente hay 187 investigaciones abiertas en entornos residenciales colectivos y entornos no residenciales con al menos un caso confirmado de COVID-19. Next slide, please. Este gráfico muestra las tendencias de casos, hospitalizaciones y muertes en nuestro condado desde el comienzo de la pandemia al 6 de octubre de este año. La ligera tendencia a la baja en todas las métricas ha continuado con nuestro promedio diario de casos por debajo de 1,000 al 5 de octubre. Nuestro promedio diario de casos es ahora de 925, un 18% más bajo que la semana anterior. Mientras tanto, el promedio de hospitalizaciones diarias se redujo a 781, un 14% menos que la semana anterior, y las muertes disminuyeron un 25% a un promedio de 12 por día. Aunque estamos agradecidos de que estos números disminuyan, todavía tenemos una transmisión sustancial y tendremos que estar atentos si queremos reducir la propagación del virus. Next slide, please. Hacemos seguimiento de los datos usando conteos para poder capturar cómo afecta el virus a nuestros residentes y las comunidades. Esta diapositiva muestra el conteo de casos y hospitalizaciones desde marzo del 2020 ordenados por estado de vacunación. Aquí las líneas punteadas representan los resultados en personas no vacunadas, mientras que las líneas continuas representan los resultados entre las personas que han sido vacunadas. Desde julio del del 2021, las personas no vacunadas han representado la mayoría de los casos y hospitalizaciones, como puede ver en las líneas punteadas de color verde y naranja. Si bien las líneas están más juntas ahora que no estamos en medio de un pico de la pandemia, todavía el número de personas infectadas no vacunadas duplica el número de quienes están vacunadas. Next slide, please. Aquí puede ver las muertes por vacunación con líneas de puntos que representan nuevamente los resultados en personas no vacunadas y líneas continuas que representan los resultados en personas vacunadas. La cantidad de muertes entre las personas vacunadas ha sido casi plana durante todo el aumento reciente de casos. Como puede ver en la línea continua que casi no se puede ver en el eje del gráfico cerca a la parte inferior de la gráfica. Aunque las muertes ahora están disminuyendo, todavía estamos viendo un promedio de 12 muertes por día, la gran mayoría de ellas entre personas no vacunadas. Next slide, please. Nos han pedido que hablemos de datos basados en nuestro número bruto de casos, hospitalizaciones y muertes por estado de vacunación. Con el objetivo de ser transparentes, hoy compartimos estos números en las próximas diapositivas. Una de las razones por las que no compartimos estos números brutos de forma rutinaria es porque solo cuentan una parte de la historia. Podemos comenzar mirando los números de casos por grupo de edad en esta diapositiva. Aquí puede ver el número de casos entre las personas de 12 a 17 años, de 18 a 49 años y mayores de 50 años sin vacunar o completamente vacunados entre el 29 de agosto y el 1 de octubre de este año. Notará que entre los adolescentes y los adultos más jóvenes, el número de casos entre las personas no vacunadas es mucho más alto que el número entre las personas vacunadas. Mientras tanto, entre los adultos de 50 años o más, se infectaron más las personas vacunadas de las que no lo estaban. Algunos pueden mirar este último conjunto de números y preguntarse si la vacuna es dramáticamente menos efectiva en las personas mayores que en las personas más jóvenes. Esto se debe a que estas cifras carecen de la siguiente información clave. El número de personas vacunadas y no vacunadas que habrían podido infectarse durante este periodo. Entre los 2,9 millones de adultos de 50 años o más en el condado de Los Ángeles, los grupos de individuos vacunados y no vacunados son de tamaños muy diferentes, porque el 78% de los adultos en este grupo de edad están completamente vacunados. 5,000 infecciones entre 2,3 millones de personas completamente vacunadas es una cifra muy diferente, mucho menor, y en este contexto menos preocupante que 5,000 infecciones entre 425,000 personas no vacunadas. Next slide, please. Esta diapositiva que muestra nuestras tasas de casos por cada 100,000 personas durante el mismo lapso, también dividida por estado de vacunación y de edad, nos brinda una imagen más completa de lo que está realmente sucediendo. Las personas no vacunadas se infectan muchas más veces en cada grupo de edad que las personas vacunadas. Si bien la diapositiva anterior podría llevarlo a creer que los adultos mayores de 50 años no vacunados y vacunados tienen aproximadamente el mismo riesgo de infección, la diapositiva muestra que el riesgo para los adultos mayores de 50 años no vacunados es en realidad 5 veces más alto que el de sus homólogos vacunados, es decir, 1,124 casos por cada 100,000 individuos no vacunados en comparación con 222 casos por cada 100,000 personas vacunadas. Next slide, please. También podemos observar las hospitalizaciones recientes, primero por números brutos. Como puede ver, las hospitalizaciones son muy raras entre los adolescentes y más comunes en los adultos mayores. En todos los grupos de edad, el número de hospitalizaciones es sustancialmente mayor entre las personas no vacunadas que entre las que han sido vacunadas. Next slide, please. Pero nuevamente, como muestran las tasas, las cifras brutas no cuentan toda la historia. Si bien la diapositiva anterior indicaba que entre estos tres grupos de edad, la probabilidad de que las personas no vacunadas fueran hospitalizadas era de 2 a 9 veces más que la de las personas vacunadas. Las tasas en esta diapositiva muestran que el riesgo de que las personas no vacunadas sean hospitalizadas es en realidad de 12 a 22 veces más de lo que es para las personas vacunadas. Next slide, please. Nuevamente, el grado de protección que la vacuna ofrece a las personas, en especial a los adultos mayores, no queda bien explicado con el número de muertes por grupo de edad y estado de vacunación que hemos visto. Tenga en cuenta que durante este periodo se contaron 21 veces más muertes entre personas de 18 a 49 años no vacunadas y 3 veces más muertes entre los adultos no vacunados de 50 años o más que entre las personas vacunadas en estos grupos de edad. Next slide, please. Sin embargo, cuando observamos los números de muertes teniendo en cuenta el número total de la población del grupo, vemos que las tasas de muerte son de hecho 32 veces más altas entre las personas no vacunadas de 18 a 49 años y 20 veces más alta entre los adultos no vacunados mayores de 50 años. Aunque en el futuro compartiremos regularmente tanto las cifras brutas como las tasas, el impacto real de la pandemia y la verdadera magnitud de la protección que ofrecen las vacunas se comprende mejor al observar las tasas. Next slide, please. Para ayudar a cuantificar el nivel de protección que nos brindan las vacunas, continuamos compartiendo los resultados entre las personas completamente vacunadas. El gráfico en esta diapositiva muestra a escala el número de casos, hospitalizaciones y muertes entre personas completamente vacunadas. El gran recuadro verde representa los más de 5,7 millones de residentes que ahora están completamente vacunados. El pequeño recuadro púrpura en la esquina inferior izquierda de este recuadro verde representa las casi 61,000 personas completamente vacunadas que dieron positivo por COVID al 9 de octubre del 2021. En total, dieron positivo un poco más de 1% de las personas totalmente vacunadas en el condado de Los Ángeles. De los que dieron positivo, un poco más de 2,000 personas fueron hospitalizadas frente a 1,963 la semana anterior. Esto se traduce en que el 0,04% de todas las personas completamente vacunadas fueron hospitalizadas. Las muertes en este grupo durante este intervalo también aumentaron de 281 a 311, lo que se traduce en que el 0,005% de las personas totalmente vacunadas fallecieron. El lento aumento de estos números no es una sorpresa, porque cuanto mayor es la proporción de personas vacunadas en el condado, es más probable que las personas que se infectan con COVID incluyan personas vacunadas. Lo que nos tranquiliza acerca de este número es que el aumento es muy lento, lo que demuestra cuán poderosamente protectoras son estas vacunas contra los resultados más graves de la infección por este virus. Y esto es lo que nos da confianza de que las medidas para aumentar la vacunación representan nuestra mejor esperanza para poner fin a la pandemia. Next slide, please. Como parte del monitoreo regular para comprender los posibles riesgos futuros, hicimos un seguimiento a los resultados de la secuencia de muestras de los residentes del condado de Los Ángeles. Seguimos encontrando que Delta representa el 100% de todas las variantes que se nos informan. El CDC no considera que Mu o Lambada sean variantes de preocupación, pero ahora considera a Mu como una variante que se está monitoreando, lo que indica que tiene propiedades que justifican el seguimiento. Debido a que la Organización Mundial de la Salud identifica tanto a Mu como a lambada, como variantes de interés, ya que se han asociado con un contagio comunitario significativo o con brotes de COVID en varios países, continuamos vigilando la distribución de estas variantes entre las muestras nuevas e históricas. Esta semana no informamos variantes de lambada o muy recientemente identificadas, lo que deja nuestro número total de casos vinculados a variantes de mu en 270 y los casos vinculados a lambada en 28. Solo 8 de los casos de mu identificados se presentaron después del 15 de agosto de este año. Continuaremos actualizando periódicamente las tendencias de las variantes entre los residentes del condado de Los Ángeles. Next slide, please. Dado que todavía tenemos un contagio sustancial en el condado de Los Ángeles, las escuelas de kinder a grado 12 siguen enfocadas en brindar la mayor seguridad posible para el aprendizaje en persona. Si bien tenemos mucha evidencia que muestra la protección que ofrecen las vacunas, nuestros datos sobre casos escolares y contactos cercanos demuestran el impacto protector de otras medidas preventivas, especialmente el uso de mascarilla. Estas líneas de tendencia muestran casos de personal y estudiantes y contactos cercanos. La mayoría de los casos aquí representados se diagnosticaron mediante la detección sistemática de casos asintomáticos que identifican a muchas personas infectadas que normalmente no serían detectadas. Este gráfico, las líneas en tono rosado representan casos, mientras que las líneas en tonos verdes representan contactos cercanos. Los tonos más oscuros representan los datos de los estudiantes, mientras que los tonos más claros representan los datos del personal. Como recordatorio, debido a que la cantidad de contactos cercanos de los estudiantes es mucho más alta que las otras métricas que mostramos en esta diapositiva, estas se trazan en un eje diferente a la derecha de la diapositiva. La semana pasada vimos 591 casos de estudiantes y casi 2.400 contactos cercanos de estudiantes, disminuciones de alrededor del 45% en ambos grupos con respecto a la semana anterior. Entre el personal vimos 88 casos y 171 contactos cercanos. Dado que tenemos más de 1,7 millones de niños y personal que asiste o trabaja en más de 3.000 escuelas en todo el condado, estos son números sorprendentemente bajos. Esto equivale a que el 0,04% de los estudiantes y el personal dieron positivo y a que el 0,2% se identificó como contacto cercano. Estos bajos números representan lo duro que han trabajado los superintendentes, el personal, los padres y los estudiantes para implementar estrategias de mitigación de forma consistente. Estos esfuerzos están haciendo posible mantener seguras a nuestras comunidades escolares. Next slide, please. Aunque la mayoría de los casos que se presentan entre transición y el grado 12 no están asociados con brotes, 3 o más casos relacionados con el contagio en las escuelas o programas escolares cumplen la definición de brote. En estos casos, dedicamos recursos adicionales a investigar sus fuentes y prevenir la propagación entre los estudiantes, el personal y las comunidades. El número de brotes aumentó en las últimas 2 semanas, de 5 brotes la semana que terminó el 2 de octubre a 14 brotes la semana que finalizó el 9 de octubre. 9 de los brotes de la semana pasada ocurrieron en escuelas primarias, 3 en deportes juveniles y 1 en cada una de las escuelas primarias y secundarias. Dada la cantidad de escuelas abiertas y la variedad de actividades en las que los estudiantes y el personal se involucran, no sorprende ver que el número de brotes fluctúe. La mayoría de los brotes, particularmente en las escuelas primarias, ocurren entre grupos en los que la mayoría no están vacunados, donde sabemos que el contagio es mayor. Next slide, please. Esta diapositiva muestra el número de casos y contactos cercanos relacionados con los brotes que se mostraron en la anterior diapositiva. No, lo sorprendente es que si bien el número de brotes casi se triplicó, el número de casos y contactos asociados con ellos aumentó mucho menos. La semana pasada, los casos de estudiantes representados en rosado oscuro aumentaron un 19%, de 95 a 113, mientras que los contactos cercanos de estudiantes representados aquí en verde oscuro aumentaron un 37%. Mientras tanto, los casos del personal pasaron de 11 a 18 y los contactos cercanos de personal disminuyeron de 11 a 1. Aunque la cantidad de estudiantes y personal afectados en brotes más recientes aún puede aumentar, estas cifras están subiendo muy lentamente. Next slide, please. Desde el 16 de agosto hemos visto un total de 21 brotes en programas deportivos juveniles. De estos brotes, 16 se han asociado con el fútbol americano, 4 con equipos de baile y porristas y 1 con béisbol. En general, estos brotes involucraron 394 casos y 1.527 contactos. La mayoría de las personas infectadas no habían recibido la vacuna. Continuamos encontrando que los factores asociados con la propagación incluyen el uso inconsistente de la mascarilla, la socialización dentro y fuera del campus, distanciamiento inapropiado en los vestidores y salas de levantamiento de pesas y el transporte compartido hacia y desde los eventos. Aunque las lecciones aprendidas para evitar la propagación se encuentran en esta diapositiva, los participantes deben tratar de minimizar el tiempo que pasan en los vestuarios y los salones de pesas y, si es posible, ducharse y cambiarse en casa antes y después de las prácticas o de los juegos. También ayuda a mantener la distancia en estos espacios, usar siempre mascarilla y evitar mezclar los equipos. En las salas de pesas en particular, espaciar el equipo tanto como sea posible para permitir el distanciamiento seguro de las personas que lo utilizan y ventilar como sea posible al abrir puertas y ventanas y usando ventiladores. En las prácticas, juegos y actividades al margen, manténgase alejado de los demás y minimice el contacto físico innecesario. Cuando sea posible, haga la práctica o los juegos al aire libre. Y en general, ayuda a recibir el riesgo de propagación si se vacunan todos los estudiantes de los grupos aprobados, si periódicamente se hacen pruebas de detección y si se lavan las manos con frecuencia. Next slide, please. Tenemos la suerte de contar con un amplio suministro de vacunas. Ahora hemos administrado más de 12,7 millones de dosis de vacunas en comunidades de todo el condado. Al 10 de octubre, el 93% de los residentes del condado de Los Ángeles de 65 años o más habían recibido al menos una dosis de la vacuna, al igual que el 79% de los residentes de 12 años o más. El 70% de los residentes de 12 años o más han sido completamente vacunados. El 70% de los adolescentes del condado de Los Ángeles entre las edades de 12 y 17 recibieron al menos una dosis y el 61% están completamente vacunados. De todos nuestros casi 10,3 millones de residentes del condado de Los Ángeles, incluidos aquellos que aún no pueden recibir la vacuna, el 68% ha recibido al menos una dosis y el 60% está completamente vacunado. Hasta ahora se han administrado casi 270,000 dosis adicionales o de refuerzo en el condado de Los Ángeles. Como recordatorio, las dosis de refuerzo solo están disponibles para quienes recibieron su segunda dosis de Pfizer hace al menos 6 meses. Estimamos que alrededor de 1 millón de residentes del condado de Los Ángeles reúnen las condiciones para recibir el refuerzo e instamos a las personas mayores de 65 años y mayores de 18 años con afecciones de salud subyacentes a que se aseguren de recibir sus dosis de refuerzo antes de que el clima se enfríe y llegue la temporada de vacaciones. Hoy y mañana, el Comité Asesor de Vacunas y Productos Biológicos Relacionados de la FDA se reunirá para discutir la necesidad de refuerzos para quienes recibieron las vacunas de Johnson & Johnson o Moderna, y ya hemos escuchado que el comité recomendó hoy la aprobación de la vacuna de refuerzo de Moderna. El comité también revisará los datos sobre la seguridad y eficacia de mezclar y combinar las dosis de refuerzo, lo que implicaría recibir una vacuna de marca diferente para el refuerzo que la recibida para la serie original. Una vez que el CDC finalice la aprobación de los refuerzos, nuestra vasta red en todo el condado está preparada para comenzar a administrar estos refuerzos adicionales a todos quienes reúnan las condiciones según lo determinado por la directiva de CDC. Next slide, please. Aunque nos encantaría ver que este gráfico muestra un gran aumento en la cantidad de primeras dosis administradas en toda la red del condado, nos mantenemos en niveles relativamente bajos. Como puede ver, entre el 4 y el 10 de octubre administramos un poco más de 41,000 dosis en toda la red del condado, una disminución de aproximadamente 5,500 con respecto a la semana anterior. Si bien las cifras de la semana pasada podrían aumentar en unos pocos miles una vez que se completen todos los informes, esto indica que nuestro progreso en la vacunación aún va mucho más lento de lo que deseamos a pesar de nuestros mejores esfuerzos. Lo más importante que podemos hacer como comunidad para reducir nuestro riesgo de que haya otra oleada de casos es disminuir el número de personas no vacunadas. Por eso es que mantenemos nuestro compromiso de dar prioridad a ayudar a las personas no vacunadas a obtener sus primeras dosis de la vacuna en todo el condado. Dado que la FDA tiene programado para finales de este mes revisar los datos sobre seguridad y efectividad de la vacuna Pfizer para niños de 5 a 11 años, nuestra red de vacunación del condado se está preparando para cumplir con las demandas adicionales de administrar dosis a casi 900,000 niños. Trabajamos con escuelas, proveedores de atención pediátrica y familiar y socios comunitarios para garantizar el fácil acceso. Next slide, please. Con la urgente necesidad de evitar otra devastadora oleada invernal, la semana pasada entraron en vigor nuevas órdenes del oficial de salud para crear protecciones adicionales en entornos de alto riesgo en todo el condado. Están implementando requisitos de verificación de vacunas los bares, cervecerías, sitios para catar vino, destilerías, clubes nocturnos y discotecas, junto con mega eventos al aire libre al que asisten más de 10,000 personas. A partir del 7 de octubre, la orden del oficial de salud que se aplica a bares, cervecerías, sitios para catar vino, destilerías, clubes nocturnos y discotecas requiere que todos los clientes y empleados, excepto los menores de 12 años, presenten el comprobante de que han recibido al menos una dosis de la vacuna junto con una identificación con foto para ingresar a las partes interiores de dichos establecimientos. A partir del 4 de noviembre, esto se ajustará para requerir prueba de vacunación completa. Como recordatorio, todas las personas tendrán que seguir usando mascarilla en interiores y no existe la alternativa de presentar prueba negativa en estos establecimientos. A un cliente o empleado que no tenga el comprobante de vacunación se le permitirá ingresar a las partes interiores de los establecimientos solo si usa mascarilla y solo con el propósito de acceder a áreas al aire libre, a los baños, hacer un pedido, pagar en la caja registradora o recoger un pedido. A partir del 7 de octubre, la orden de nuestro oficial de salud que se aplica a los mega eventos al aire libre con más de 10,000 asistentes requiere el comprobante de vacunación completa o una prueba de diagnóstico negativa reciente para todos los clientes mayores de 12 años. A partir del 1 de noviembre, también solicitaremos a todos los clientes mayores de 18 años se les verifique el comprobante con una identificación con foto. Este es el mismo requisito para los eventos en interiores con más de 1,000 asistentes y se requiere el uso de mascarilla en todos los mega eventos en interiores y exteriores. A la fecha, hemos visto un excelente cumplimiento de las nuevas órdenes del oficial de salud y agradecemos tanto a los establecimientos como a los clientes por dar este paso adicional, para ayudarnos a evitar un invierno desastroso. Queremos reconocer que los desafíos operativos en los lugares de eventos grandes son importantes y estamos agradecidos por su continua colaboración. Next slide, please. A medida que la temporada de deportes de otoño se pone en marcha, sabemos que muchos de ustedes se dirigirán a los bares deportivos y a nuestros increíbles estadios locales para ver los grandes juegos. La mejor manera de disfrutar de manera segura es estar preparado y listo para cumplir con las directivas de salud pública. Antes de ir a su bar de deporte favorito, asegúrese de que usted y los adolescentes que lo acompañan hayan recibido al menos una dosis de la vacuna, si es antes del 4 de noviembre o si están completamente vacunados, si es el 4 de noviembre o después. Todos los miembros de su grupo deben llevar un comprobante de vacunación y una identificación con foto y planee usar mascarilla en el interior, excepto cuando esté comiendo o bebiendo activamente. Es posible que desee considerar el uso de las áreas al aire libre del establecimiento para estar más seguro. Si se dirige a un lugar local para ver un juego en vivo, asegúrese que usted y los adolescentes que lo acompañan estén completamente vacunados o hayan recibido un resultado negativo de la prueba COVID recientemente. Planee que todos los miembros de su grupo mayores de 18 años lleven consigo el comprobante de vacunación o la prueba con resultado negativo, así como una identificación con foto. Y una vez que esté en el juego, por favor usen mascarilla, excepto cuando estén comiendo o bebiendo activamente. Tenga en cuenta que estas reglas son establecidas por el Departamento de Salud Pública y los establecimientos están obligados legalmente a cumplir. Tiene poco sentido descargar su inconformidad con el personal de cualquiera de estos lugares. La esperanza de que al agregar protecciones adicionales, evitemos un aumento invernal que nos obligue a dar pasos hacia atrás en el trayecto hacia la recuperación. Así que, por favor, planifique con anticipación para agregar precauciones adicionales mientras experimentamos la emoción de la victoria, independiente de donde estemos viendo el juego. Muchas gracias.